Hi, I'm Dr. Annbel D. Herrera. This is part 3 of my series on endometriosis. Endometriosis is a condition that may happen in a woman's childbearing and reproductive years until menopause. In a normal menstrual cycle where menstrual blood should flow out of the body from the uterus to the cervix and out through the vaginal canal, instead in endometriosis, some of the menstrual blood doesn't flow out but finds its way in places where they do not belong. How does this happen? Remember that in each menstrual cycle, the endometrial lining cells of the uterus respond to the hormones produced by the ovaries, so they thicken, they break down, and turn into the menstrual blood, which is supposed to leave the body. With endometriosis, some of that menstrual blood, which contains the endometrial lining cells, do not leave the body, but instead they attach and grow in the areas where they don't belong. We refer to those as endometrial implants. When a woman with endometriosis menstruates, those implants also bleed and menstruate wherever they are located. So where are some places where we can find these endometrial implants? Generally in two places, internally and externally. First, they can be found inside the uterus, specifically the myometrium or the muscle layer of the uterus. This condition is called adenomyosis or internal endometriosis. What happens is that these endometrial implants insert themselves in the gaps between muscle fibers of the uterus. And so a woman who has adenomyosis means that she is menstruating internally because these implants become bleeding sites. Second, they can be found outside the uterus, and this would be known as the external endometriosis, generally found in the fallopian tubes, ovaries, back of the uterus, and in the pelvic area or the surrounding tissues and organs like the intestines or the bladder. If they're found in the ovaries, ovarian cysts or endometriomas are formed. If they're found in the pelvic area, back of the uterus, or surrounding tissues or organs, these organs stick to each other and form adhesions, and that is called pelvic endometriosis. So a woman with either adenomyosis or external endometriosis menstruates. Those endometrial implants that I mentioned also menstruate and bleed wherever they are. Now that I've explained what endometriosis is, we can talk about the signs and symptoms of this condition. Stay tuned and see you in my next video.